Okay, so you did the station excellently well. Like I would say, like you could get full mark, or they can deduct 2 marks. Some for some few point I will address, but I will go in orders for everyone to know how to address the stations. So you follow the introduction, as we said, we have to follow the exact instructions, introduction in all stations, which you introduce yourself to the patients, you confirmed the son identity and confirmed that he's the next of kin, which is good. I would always say that I don't know, all of you still, you don't like to do that, uh, like about confirming the reason of the meeting and take permissions. It could be acceptable if you are doing it in any other country, but in the UK, you have to take permission for everything. Even like just to, it will be like, we know that it's naturally like to update our patients, and they hear and they would love to be updated. So it seemed to be like not nice to take permission, but the thing that not because they don't want to be updated. This, we take permission just if he likes me or not. Because honestly, there's some people they don't like to be updated by you. They want to like to be updated by other doctors, and we can say nothing about it. So it will be kind just to ask to take permission. Is it okay to discuss with you some issue regarding your father health? It wouldn't take you 2 seconds, so it's fine. And how much you ask, how much do you know about your father conditions? And you continued to explain more about what happened, but I think you spent too much time in explaining the heart attack, which the patient told you. You asked him, you did the right thing by asking him, do you know what heart attack? He told you, yeah, I know what heart attack. And you could just explain about the procedures and don't focus on, because already the father died, so I would not put too much information about the procedures and but maybe my focus will be on the side effect of the procedures, like and like why do you do these procedures, why first, why we do PCI for everyone, and why did we do it. And I think you spoke about this, like we had to save his life, and it was like urgent thing to do. And the most important point to talk to tell that we took consent from your father. So your father has a mental capacity, and he signed informed consent, which discussing all the side effects and the risk of the procedures. So BCI, despite its life saving, but it could have some side effects. So he could have died from the side effect of the procedures. We don't know. So these stations, we deal with it as a medical error. And that's why I brought this station. I told you I need to today to discuss medical error. So, but this kind of medical error is, we don't have responsibility like toward the patients, or we didn't do something wrong, because it's expected side effect for procedures. He signed a consent form, but still, if he and you already know this because you told him, as your father died suddenly, we had to refer to the medical examiner, which you showed me as examiner that you already know this patient could be died for any other reasons, or even like the one who do the PCI may be not expert enough. We don't know yet, and this is happens in the real life as well. So there is some, despite the fact that the father signed off the consent form, which is really important point to emphasize that the fathers consented to the procedure and its side effects. But still, is it happens because of the expected side effect, or is it happen because of lack of experience of the some of that person who did it? And most likely no, yes, but still we need to deal with it as medical error. We need to apologize. We need to investigate the issue. So we will tell him your father like signed and is expected risk, and it's unlikely there is something happened from for our teams. We have an expert teams, and if we did it on daily basis, yeah, you will like try to protect yourself, but we know that we need to make incident report form. And not only that, even in these situations, we need to do postmortem examination. So it's a good thing you pointed out about the examiner, like medical examiner. So this because any patient who died suddenly on the table of the operations or around it, we need to investigate because it could be side effect of the procedure itself. And this side effect, we need to make sure, is it intentional or not? You know, English people, they don't leave things for chance. There is 99.9%, it's just expected complication from the procedures and nothing from our side at all. But still, to close this file, we need to investigate it further. But at the same time, that we are not, as you did exactly, so we're not going to distress the patient. We're not going to show him as we did a mistake. No, in fact, we will emphasize that your father consented to the procedures. It expected side effect of the procedures, but the benefit outweigh the risk. We did that to save his life, because if we didn't do the procedures, he could have died immediately. That's why we make him to sign this form, which is showing that the procedure has side effect, and also explain for him the risk and benefits. And we also, as I said, we emphasize that we have expert teams and whatever, but we will going to, and in this station, the patient will tell you, I want to complain, you killed my father, so no problem, we will guide you to complaint procedure. We also write incident report form to investigate this issue further, despite the fact that the father, like, I'm still repeating the same point about it's most likely no issue from our side, but just to close the file, as I said, we have to make it as medical error. So you went like you had extremely good sympathy and empathy with the tone, which is something I like it a lot. So you really feel naturally, you feeling the patient pain. You really like the word you used. It comes from you natural, and excellent, like full mark sympathy and empathy. And you broke the news gradually, like you told him uh, uh, it's not as we hoped, and gradual told him, I'm really sorry, your father deteriorated, and you later on told about the death. So you didn't give it to him one go, and you acknowledge his feelings throughout, which is really excellent. And so yeah, you should have apologized for what has happened, because even is like expected side effects of the procedures, but still apologize. And today I was reading the GMC guidelines, or the about the duty of candor, which is when medical error happens. They said apologizing to a patient does not mean that you are admitting legal liability. This is what they write in their own words. So the GMC, I could see in many groups in the past, like people say, if you apologize, it means that we admit the mistake, and it means that we did a mistake. No, even the GMC said apologizing to a patient does not mean that you are admitting legal liability. It doesn't mean we did a mistake, but it makes them feel nice, because some patients only need apology from you. They don't want anything apart from apology. And especially for English people, it means a lot when you apologize. So, and the patient, the surrogate, now he asked you, do you want to apologize for me? So it's really good to apologize, and you apologize after that when he asks you. So we need to apologize for what happened on behalf of the teams, and we are really sorry for what happened to your father. And I know it's a lot for you, as you explained, like you seeing your father fine, and all of a sudden being told that he died, but unfortunately he had a serious heart attack. You need also to mention that he died not just because of us, but because of the heart attack he had. Because it's really important for the patient when they go home to feel that uh, we didn't kill. Like, despite there could be, as I said, very, very, very trivial percentage that could be some error has happened. But I need to emphasize that the father died from the heart attack, which is very serious disease, and the procedure itself has expected side effects. Not anyone has it, and it's a life saving, but we should do it to save us his life. So we need to emphasize that we did the right things, and there was no any intention to harm him, as you mentioned. I think you handled the situation very well, and. So yeah, I think the point you missed, like about the fathers already consented to the procedures and being told, informed about the risk of the procedures and its expected risk. But yeah, so this is really important point to address in these stations. And you nicely offer support to the sons as someone who had just someone died. So he could have like chaplain or any bereavement to contact the bereavement office for them if they need any spiritual support, any psychological support. And it's really important, and it's really important to offer, as I said, in all stations, we have to follow extra support like website, brochures, even if like now it doesn't feel like it because he's in bereavement, but still he may be in denial or he thinks that we killed, so he need to know about the risk in details when he's ready to read. So still I can offer him about the PCI and the risk and benefits. Excellent, very well done. I will speak a little bit about the duty of condor, which is like when errors happens. Like health care. This is according to the GMC. Healthcare professional must be open and honest with patients in their care once something went wrong. So, as I said, it's not necessarily to be our mistake. When we talk about medical error, it doesn't seem to be like, in fact, it has to be unintentional. This is the first thing, because if it is intentional mistake, this is negligence and this is something else. Because if there is negligence, in this case, who even did the mistake need to be penalized, need to be questioned. Sometimes they can lose their license if it's serious mistake. So negligence is very big issue and normally doesn't happen in the real practice here in the UK unless the minor negligence, like the nurses didn't clean the patients, mainly nursing issues, but for doctors, like to make intentional negligence, this is extremely unlikely. And I said like the duty of condors for the GMC saying, first you need to tell the person when something has went wrong, as in this station, the patient has PCI and he died. So we need to tell them and we need to apologize, okay? And we need to offer appropriate remedy or support to put matter right if possible. In this station, it's not possible because the patient died. But as you said, the support could be different. We can't fix what happened, but we can, like at least we have the son here. We need to offer him the right support. We need to, um, as you did, like to make sure that he's not going to suffer after what happened to his fathers because of us. And third thing, explain fully to the person the short and long-term effect of what has happened. So also in these stations, nothing here, but if for example, side effect of medications, we need to tell like about the short and long-term complication they can develop and how we can fix it. It's really important to tell about that if any kind of medical error happened. So like the patient, they will expect you to speak about what exactly has happened and what can be done to deal with any harm caused. As I said, like how we are going to fix the problems. And another thing the patient will be looking for, what will be done to prevent this from happening again. And this is how we prevent it by doing incident report form. So we said we're going to report the incidents and discuss it in our units to prevent this happening to any patients. But it's not applicable to these stations because this station PCI is expected side effects. So we don't need to speak here about incident report form, but apology. And if the patient wants to complain, we will guide them. But in this station, I think um, unless it's not clear from the task how he died, but honestly, if someone can speak in this more, but is I could see like many people take it in a different way. So some, for example, now Roch, he took it in like it's not a medical error as just expected side effect, and the patient already signed the form and consented to the risk to the side effect, and this is side effect. And it's just, but it will be for you is very clear in the sorry, it's going to be very clear in the task if it is medical error or not. So we said, what is the postmortem corner if needed? Let's go to the message. 1 second. So when is postmortem corner is needed for this during or shortly after procedures? Yeah, it has to be exactly during or shortly after the procedure. So it will be clear in the task if this patient died like uh, a few hours after the procedures, and we know that, for example, he had a uh, say bradycardia, which is expected side effect of the procedures. So it's nothing from our side. But if he died by bleeding, so he had internal injury, so this is different. So this is need post-mortem. So it depends on the exact cause of the death, if it's clear or not clear. So we do post-mortem when the cause of death is unclear and happened in the time of procedures or around it, even like it's still within few hours after the procedure. Still, it could be happen inside the operations. It could be a problem from the surgeon himself. That's why we need to investigate if there is uncertainty. The most important thing, we know there is no clear cause. But if the cause is clear, it will be documented in the system. For example, could be arrhythmia. It is expected side effect, nothing to do with the surgeon. But if it's hemorrhage, so we know that the cause of hemorrhage, so we don't need postmortem, but we need to report it as medical error, and we need to make with it as a side effect, like to tell the patients it's happened from our side. This is mistake. If and it depends, the circumstances could be so even bleeding expected side effect of, but it depends on, so they will investigate to see if this whoever did it is professional enough, they didn't do any mistake, or someone like trainee, he was learning. So it depends on all the circumstances, but we do only post-mortem when the cause of death is unclear. But if it's clear, why we should do, so post-mortem is to examine their tissues, even including investigation, again, doing imaging, doing anything to find the cause of death. But if the cause of death is clear, we don't need to do post-mortem. So in this case, BCI, if the cause is clear, so we don't need to do it. And if it's the cause is unclear of this, we need to do it. So as that's so wise, so Dr. Tabi, she mentions the most important thing. So the medical examiner, and we leave it to them. The medical examiner will decide on postmortem or not. So the normally medical examiner, they will call the doctor to write about the incident led to the death. So you write it, and they will check the file of the patient themselves as well, the medical record. If the causes are convincing for them, they will write the cause of death in the death certificate. They will close the file. If there is any uncertainty, they need to do postmortem to know the exact cause of death. Any other cause? Any other, sorry, questions?
Dr. Rafa,
Yes.
is this this medical error or side effect of the procedure?
So as I said, it depends if it's very difficult. So most likely it's just side effect of the procedure and the patient already signed for it. Uh, so let me read the case again. Because I didn't read it, to be honest, in details. So Mr. Jamal, 65, came today after complaining chest pain, ECG, blah, blah, blah. PCI done for him in his best interest of his conditions after discussion risk of benefit. Even they told you in the task, and he signed the consent. So even they make your life easy, they told you it's already been discussed with the father. So this point, never ever forget it. You have to bring it to the sons. And whatever written in the task, I would always say that you have to bring every single word, because just missing any point of what written in the task. And nowadays they bring, unfortunately, very very long tasks. I don't know, but in my exam I have like very like full papers of stuff. So you have to write it down, all of it. You have to speak about all of them. If you miss anything, will drop your mark and they will comment you didn't mention this point. So they said already the father has mental capacity and they discussed for him risk and benefit and he signed a consent. Unfortunately, his condition was deteriorated after BCI and was transported to ICU and he had cardiac arrest and died away. So, so here in this case, they telling you like they trying to put you through this way. He if they mentioned like if you can feel from the tone of the writing here in the task, they telling you he already consented, so they telling you this is risk of expected side effect of the procedures. So I will deal in this case. I just make it as a side effect. I will emphasize as a rough exactly dealt with this. You all go and read it. So just I will talk about it as side effect of the procedures, and your father already signed for this side effect. So that's why you have to read the task very carefully. And if there is any information you are not sure about it in the exam, clarify with the patient, because minor changes can shift the station completely. Yeah, this station would be shift to medical error rather than side effect of medications if they didn't write for you, the father consented. So now they just trying to drag you, like they because they know the time management and everything, they will try to tell you what kind of station or pathway you want you to go through it. Because I know it's very confusing. And as I was mentioning earlier, uh, even if the father consented for the side effects, we are not sure if is it like expected side effect or side effect happened because of lack of experience of our teams. Uh, so this is the point I mentioned earlier. So and to avoid this confusion, they will make it for you clear. So now from the task is already written for you. The father consented, informed about risk and consented. So they trying to tell you take it this way. So it honestly it will be very clear as much as you clarify with the patients which way to go through it. So for example, the patient can tell you, so here, should we inform the coroner or not? Not the coroner, the medical examiner. So the medical examiner is like the steps just before the coroner. So, and the medical examiner who will decide on the coroner. So you don't need to distress yourself so much as far as you mentioned about medical examiner, which is medical examiner would happen to any patient, regardless problem. Like even if expected death, they died because of expected natural whatever, still medical examiner they need to check before to avoid this and decide if the patient need postmortem, need corona or not, or corona. So don't stress yourself so much, but you need to mention about medical examiner is important if any this happened all of a sudden. And what I was saying, so how to take the stations, medical error, negligence, uncertainty. The patient will make it for you very, very clear how to go, which way. So read the task very carefully, read the tone of it, try to know what they want. Like now, just reading the task, I knew that they want you to go through side effect of procedure. They don't want you to mention about anything else. Despite there could be medical error, but they don't want you to go this pathway. They want you to take it as a side effect of procedure because they told you the father informed about the side effect of the PCI and he died from the PCI. So you need always to read your task very, very carefully because it will be different from day to day. Everyone will say they have the same case, but it wouldn't be the same case. You know, if the case is coming exactly the same, no one will get low marks. Many people fail, many people go just a pass. Why? Because they make minor changes. They want to direct you toward a specific pathway, like if you want to take it medical error, if you want to take it like just side effect of procedures, but it will be very clear for you as far as you are ready to find out. But if you came from home by searching informations, you already know the station, you want to do it this way, you will fail. So try to read their task very carefully from outside, write it down. I want to cover all these points and clarify with the patient. If you are not sure how to take the stations, clarify the patient. The patient will guide you exactly how to do it. You know. So, for example, if he wants to take it as medical as a mistake, he will tell you how I can guarantee that no one killed him, how I can guarantee that it's not a side effect of the procedure. It's just the doctor who did it, he doesn't know how to do it. So he will tell you, take it this way, take it as a medical error, don't take it as a side effect. But if they wanted to take it as a side effect of procedures, he will tell you when you explain to him the father signed this consent, informed consent, I will say okay, and he will never argue with you anymore. So it will be clear for you. Just be present in your exams and try to listen to your patient very carefully and try to go with them in their direction. Don't go in your own directions.
I don't understand, Doctora, what you mean. What is the direction? Is
Yeah,
surrogate technique mean direction of medical error?
yeah. So the surrogate will guide you how to approach the stations. For example, this station now we're dealing with it. Like, is it the question is if I read the station, I will say the question, is it side effect of procedures or is it a medical error? I don't know. Okay. So the surrogate, the way he will act to you, you should know how to proceed with the stations. For example, if because the surrogate, he would know he wouldn't have flexibility. You know, he have a script and he cannot get out of it at all. And whatever he had in his head, this is the stations. That's why it's really important to get what inside the surrogate head out of them. And that's why when you ask them more, if they ask you, even if they ask you questions, return it to them back by a question. May I know why you ask this? So he will tell you what in his head, and now you will clearly know the station. So for this station, as was saying, if you tell him your father's, and it's written in the task outside, even they helping you. So the father already signed to the risk of the PCI, and he died after the PCI. They want you to take it as side effect of procedures. And when you explain this to the surrogates, he will agree. If he didn't agree, he told you, no, how can I make sure it's just side effect of procedures and it could be you killed him because of lack of experience. So in this case, it means he wants you to take it as medical error. He's not convinced about side effect of procedure.
So now in such a situation, he
Mm.
said maybe your doctor is not experienced, and I think it is a complication of the procedure, not error. So still now this scenario is uncertainty.
Yeah,
So
exactly. So no problem. Just
yes.
like if it's uncertainty, what we do in uncertainty, still we behave as it as a medical error. We apologize, as the GMC said, apologizing, it doesn't mean we did a mistake. It's just to make the patient feel good. The second thing we'll do the incident report form to investigate it further because uncertainty need to be investigated. If confirmed that the patient, it even will give the patient a new peace of mind. So you know that it's not from your side, but the patient not need to be reassured. So we'll do incident report form, we'll investigate it, and the investigation will tell the patient exactly what happened, and the patient will be
So
confident. Yeah.
uh, yes, I'm sorry, Wallahi, to interrupt you, but
No, 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 no problem at all. Yeah, yes,
I
please.
wanted to make it I wanted to make it sure. Now, from the early of the discussion, I talked to the surrogate that this is a complication because this is big MI, blah, blah, blah. And he said, no, this is medical error because your doctor is not experienced. So he's still struggling with me and negotiating with me. So at that time, I will tell him, sorry, it is uncertainty, and you will address your complaint and will investigate and most mortem examination. This will decide. So now, according to your explanation, he take me to another in his direction. Is that right, or I'm wrong to understand this?
Yes, let's say it again in another way. So the first thing, the most important thing, which is written in the task, to tell him this is expected side effect of the PCI, and your father signed to it. So after saying this information, if he early on speak about you kill your father, whatever, it is still very important to mention this point about PCI. It has risk. It has its own complication, and he signed a consent form. If after saying this sentence, the patient accepted your sentence, it means the station about side effect of procedures and continue the stations is just it's a side effect of procedure. But after saying this sentence, it's expected side effect of the BCI, and the patient is still saying no. I don't agree, and yeah, it could be side effect, but how I can guarantee it could be also lack of experience. So it means they want you to take the stations in the uncertainty way and do your incident report form and so I hope you made this clear. So what I'm saying, even like to know what exactly the station about, the surrogate will tell you about it. It will be very, very, very clear. It will never, because they can't, they will get stuck if you uh, took them out of what they have in the script. They can't even speak with you because they are not flexible at all. They are not allowed to go outside of this script. So
Mhm.
like exactly what to say to you and what's the station about. So as far as you getting what in their head, you will know how to approach the stations. Even if you didn't heard about it in your life, the patient will tell you exactly what to do. Just show sympathy and empathy and try to find what in their head. They will guide you through the stations. Don't distress yourself. So I feel like you confused about like how I could make the patient lead me while I know exactly what to do in the station. But you follow what you know. If the patient goes smoothly with you, it means you're doing the right thing. But if the patient took you to any other direction, don't resist him. Go with him. They want you to take the station in different way, not the usual way you already know about it. And this is how they make minor changes in the station to check your communication skills, to check who's already came with something in their head or you following your patient. So just follow him. He will take you, he will never take you off. There is no trick. There is no like telling you sentence and take you off topic, especially in the communication station. So just go with him. It will be very clear to you how to approach the station. Trust me.
Pam, I have a question.
Yes.
Yes. In this scenario, when the father was completely competent and he had full mental capacity, and we took, aren't we supposed to just deal it as a side effect of the, or you're saying if the surrogate takes us the other way, we are going to go along with him? The father did had the capacity and he did give us the consent. Then why
Yeah.
not do it as a side effect?
Yeah, so it's just it could be a possibility that the surrogate will take you. Always put it in your mind. The surrogate can take you off what you came for from. We all agree that even from what they written in the task, they trying to tell you that when they mention about you that the father informed and has mental capacity. So we know that they telling you please take it as side effect of the procedures and take it this way. But if the patient tell you, okay, so you did your right bit, you explained everything, you told him this expected side effect, and the patient, your father consented. So now you did everything from your side right. But if the patient insisted to make it like other way, you need to go with him. And doesn't mean you change your approach. It's still you dealt with it as a side effect of procedures. But if the patient want to complain, it's the right to complain, right? So we can't make complaint without incident report form. So
Okay.
there is nothing change a lot. If you can see, you're doing the station in the right way, but I'm not ignoring the patient. So if the patient want to complain and he's not convinced, I'm not going to try to challenge him and telling him no, this is side effect of the procedure. It could be he could be right. So just let's investigate this issue, uncertainty, right? So let's investigate it further, and we will keep you updated. So no problem.
والله
Okay.
يا
Thank you
دكتورة,
so much.
thank you really والله. Because this is my behavior in life. If he said to me, it is a error and you killed my father, I will tell him no, I did not kill him. This is a complication. If you wanted to introduce a complaint, you can go like this. This is my behavior really. So possibly the examiner will fail me if I struggle with the surrogate like this.
Exactly.
صح؟
And they said, yeah, I
Mm.
said never confront your patient. It's one of the thing. The confrontation is bad communication skills. They will minus you. So never say it is. Yeah, I appreciate your concern. So let me give you reassure you that we did our best. There is no any intention to harm him, and it's expected side effect. But if you are still concerned, no problem. We can investigate it further for you and keep you updated. So there is no problem. It doesn't seem that we are admitting we did a mistake. But also, if the patient feels there is something went wrong, why don't we investigate it again?
I thank you, Doctor. I mean this. Thank you.
You are very welcome.
Yes, ma'am. Another question.
Yes,
If the surrogate asks, okay, I want the name of the doctor who did the procedure of my father. So we are not supposed to name a doctor, is it?
exactly,
Or
exactly, yeah, exactly. So even when we write the incident report form in the hospital, there is no names of the who did it. As I said, only negligence, which intentional harms. This is where names should be written. But any medical error, there is no